Well, good afternoon, everyone. Thank you for joining the Keck Medicine Living Donor webinar. My name is Jim Kim, and I am a transplant surgeon and the surgical director of kidney and pancreas transplantation here at Keck Medicine of USC. Today's talk will be on living donation and kidney transplant. We'll be providing a general overview and information for people who are interested in becoming a living donor or may already be going through the process. This overview should be useful also for potential recipients who are looking for a living donor or waiting for your transplant to occur and want to know what happens on the donor side of things and all the associated risks. I think we can go to the next slide. To get us started, I'm going to hand things over to our medical director, Dr. Thin Ma.
Hi, good afternoon. I'm Thin Mo. I'm a transplant nephrologist and the medical director of the kidney and pancreas transplant program at Keck Medicine of USC. So today, I'm going to go overview of the living donor kidneys. So in general, when the patient has a kidney disease, either on dialysis or when their kidney function is below 20%, we're thinking about the kidney transplant. There are two types of donor, living donor, and the disease donor. So today we'll focus on the living donor portion. Next slide, please. So what is a living kidney transplant? So a healthy person can donate one kidney, and then donors live healthy life with one kidney. So as you know, the surgery is planned, not an emergency, and then definitely that donation is the voluntary and confidential. Next slide. So why living kidney donation matters, right? So as you know, especially for the recipient who are getting dialysis, you know how the waiting time for the disease donor transplant much longer, 8 to 10 years, depending on the blood type. But with the living donation, which you have a living donor, very shorter waiting time, and then overall better long-term transplant outcome. So that what does it mean is the kidney from the living donor lasts longer than the disease donor kidney. And also they can avoid because if the patient are not on dialysis, what we call it, before they even need dialysis, they can get the transplant. So we can get the transplant with the living donor without before going through dialysis, or they can decrease the waiting time on dialysis. As a donation is always a personal choice. Next slide. So who can be a living donor? As I mentioned, right? Anyone in your family member or friends, co-worker or neighbor or anyone who doesn't necessarily has to be a blood related or the family member. So you can have anyone who can be donated a kidney. Next slide. So what are the myths about right? So basically a lot of people has a question. So I want to ask also, what is the myth? A lot of people that donor cannot live normal life after the kidney donation. Is it true or false? So basically it is not true because kidney donor can live normal life after the kidney donation. Of course, after a few weeks, they have to do another heavy lifting, but after that, they can enjoy their normal lifestyle, whatever they're doing before the donation. And also, a lot of people think that they have to be sorry, go back. Only family can donate, or they has to be blood related. It is not true because if anyone can donate the kidney, and the kidney donor will need to take medication because that's a question I asked. A lot of donors ask, do I need to take medication after the kidney donation? No, you don't need to take any medication. Of course, if you are taking before medications, a blood pressure medication, maybe, but otherwise you don't need to take any new medication for the donation. And the transplant team for the protects the donor safety. So that is our first priority for the donor safety. Next slide. So who can be donate the kidney, right? So who can donate the kidney? So anyone above 18 year or older can donate the kidney. Of course, you need to have a good physical and mental health to donate a kidney. And then you need to have a good kidney functions to have a kidney donor. Able to safely live one kidney. So because if you have a risk after donation, then that will not be the donor. So basically we have to assess the kidney donor. So we will screen carefully by the kidney transplant team before moving forward with the kidney donation. Next slide. So the question is who may not be eligible to donate, right? That's a who can donate, but who cannot donate a kidney. So definitely, if patient who or the person who has a kidney disease cannot donate, right? Some for the kidney protein in the urine or blood in the urine, some of the certain kidney disease. And another thing is uncontrolled blood pressure. So even if you have a high blood pressure, if you're controlled, then you can still be considered, but you have to be controlled. So uncontrolled blood pressure, if you have a diabetes with complication, you cannot donate. And then serious heart or lung disease, also you cannot donate because there's a risk from the surgery. Other conditions that make surgery unsafe. So we will also review all the history and the physical, and then we will say anything it is not safe for the donation, then we will not proceed. So as I mentioned before, donor safety comes first. So we will do extensive medical testing, physical, and then emotional, psychological evaluations to make sure that it is safe for the person to donate a kidney. Another one I want to emphasize is any time point the donor can stop if they don't want to proceed with the evaluation process. So that is 100% we respect the donor decision. So healthy and safety are the priority for our donor. So how we do the living donor process, right? So as I mentioned, donor first express their interest to donate. So that's a first confidential that if the donor wants to donate, so that's they will contact us. We keep as a confidential. Only the donor team will communicate directly with the donor. And then next step is we will do the medical testing and the evaluation, and then you will be seen by the transplant nephrologist, transplant surgeon, social worker, dietitians. So you have to go through all the testing and the evaluation. Sometimes you will have the consult depending on when we see the donor. And then if everything approved, we can move forward with the donation and then we can schedule for the surgery. And the next step will be the recovery and the follow-up. So next slide. So I want to mention that a lot of patients will ask, or people will ask, is it safe to live with one kidney, or how safe is it to live with one kidney? So I will go over the long-term risk, and then Dr. Kim will be go over the surgical risk. So a lot of patients, first thing we will ask, what is my risk of dying from the donating the kidney, or what is well, I will live longer or shorter lifespan. So what is my mortality or life expectancy? So there has been a lot of study. We look at the donor, kidney donor have a similar life expectancy to people who did not donate. And then especially donor are carefully selected to be healthy before donation. So, another question is what is my risk of kidney failure or end-stage kidney disease or maybe needing dialysis in the future? So the risk is quite low, but of course it will be slightly higher than healthy, very healthy non-donor. So before the donation and after donation, the risk is slightly higher, but compared to the general population, still very low. So another question is the blood pressure because kidney regulate the blood pressure. So what is the risk of having the high blood pressure after the kidney donation? So it can happen to the some of the donor, they will develop high blood pressure over the years after donating the kidney. So that's very important to do the regular checkup after donation. And then for the women with the childbearing age, what is the risk of the pregnancy, right? That's the next question. A lot of patients ask is, can I get a normal pregnancy? So what are the pregnancy outcomes? So especially for the donor who donate the kidney, they can still have a healthy pregnancy. But like I mentioned before, the blood pressure can be a little bit elevated or high in the women who donate the kidney. So that's why very important. We have to monitor during the pregnancy of the blood pressure. So the take-home point is long-term follow-up care after the donation is very important, and then you should continue to follow up with your primary care physician. So I will hand it over to the surgical risk to Dr. Kim.
So, living donation has been around for decades, and actually, the very first kidney transplant performed was actually between a pair of twins. So, one of the twins was a living donor. The donor actually lived until the age of 79, and died from complications after heart surgery, not anything to do with kidney problems. With surgery, the overall complication rate is very low. Potential donors must undergo a thorough medical evaluation to assess their health status and risks. Potential complications, the main complications being bleeding and infection and possible wound infections or wound issues. But overall, all of and potential injury to other organs just because it is an operation. All these complications combined lead to it occurs less than 5% of the time. The risk of donor death is very similar to other routine laparoscopic procedures at much less than 0.1%. And everything we do really is geared around keeping the donor safe. Obviously, people need to take responsibility for their health over the years, but we do our best to make an assessment of the long-term risks. And preparing for surgery is, again, a key factor in being able to safely proceed with surgery. Here at Keck, we employ minimally invasive techniques for the operation. Worldwide, the open procedure is still commonly performed, but the morbidity of a big incision makes this much less attractive. And the advent of laparoscopic surgery has allowed for the expansion of living donation and an increase in the number of people donating. And there are many techniques that we employ, and we tailor it to what is right for the patient. All the techniques are minimally invasive, so they're laparoscopic surgery, which means we can make smaller incisions. We fill the abdomen with gas, which is CO2 that the body absorbs, and you're able to breathe it out after the surgery. And we remove most of that gas after the operation. There's the different techniques involve or include a single incision laparoscopic surgery. So that's one incision that's through the belly button. You can see the scarring is much more cosmetic. That's the picture on the left here. Just one 6 centimeter incision through the belly button. There's robot-assisted laparoscopy. This is a newer technique. That's the robot you see on the right-hand corner there. It's not an actual robot, it's just specialized instruments that we use. The surgeon still does the operation. There's also something called hand-assisted laparoscopy, and it's laparoscopic surgery where the surgeon is able to insert their hand into the abdomen and assist with the operation. The usual hospital stay is only overnight. The operation itself takes about 2 to 3 hours. The total anesthesia time is around 3 hours. But the procedure is around 2 to 3 hours. And like I said, the hospital stay is just one night. Next slide. And so there's follow-up with the surgeon around 2 weeks after the donation. It's a routine surgical follow-up. Then there's follow-up in clinic for blood pressure monitoring and routine blood work that occurs at 6 months, 1 year, and 2 years. And then annual routine visits with primary care physician or your own physician. The physical activity now, we do limit for a minimum of 3 weeks following the operation, and that involves any strenuous activity. So that's no real exercise, no lifting, really more than 10 pounds, no sports or jogging, running, yoga, anything like that. But generally, after about a month, most people are back to work, back to the gym, back to their normal activities. Some people do take a little bit longer, but there's no real restrictions, physical restrictions after about a month. Next slide. And then this is just a kind of an overview of the financial, and there's some practical questions that occur that our living donor coordinator will go into a little bit, and we can answer any other specific questions. But generally, the medical cost of the donation process occurs through the recipient's insurance. We do review the insurance of the recipient, which is extremely important. And out of state and even out of country insurance is considered. Confidentiality again, just want to reiterate that it's protected. And there are other support resources that could be available. Our team can help attain financial assistance through government agencies or private agencies for lost wages, travel, lodging, and such. Next slide. And we know that talking to people about possibly becoming a living donor is not an easy conversation, but the first step is always to ask. No one is going to know that someone needs a kidney transplant if they don't even know about it. And if you're considering donation, then it's always good to ask. You can message us if there's any questions that come up. We really want to educate people about donation and that it's a safe process. And if it's not right for you, if it's not right for the donor, we understand. There's many reasons that it may not be right for the donor at a particular time. For recipients, we encourage you to share your story in your own way and employ others to help spread the word. It's always easy. We call it a donor champion, someone who champions the cause of the recipient to spread the word about living donation. Next slide. And with that, I'll turn it over to our living donor coordinator, Mingus.
Hi, everyone. My name is Mingus. I'm one of the living donor coordinator nurses here at USC. And we could go, yeah. So just for kind of to explain the practical side of it, evaluation is all the testing is really done in one day. We try to do it in one day, but evaluation does take usually take over a couple goes over a couple days. So it starts with talking to, well, after you sign up, you'll talk to one of our assistants. They will do like a basic screening and then they will schedule you for a call with our donor advocate. Once you talk to the donor advocate, you'll be scheduled for a telemedicine with the social worker and one of the nurses or living donor coordinator nurses. And then once you have done that, we will pick a date for evaluation. Here at USC, all of our evaluations are done on a Monday. And we try to do all the testing that one day. Unfortunately, sometimes with scheduling, we just can't get it all there. But it is an all day thing. So you would have to take the day off from work. And donors typically show up at 6:45 in the morning. They have to do a 24-hour urine collection the day before. So you bring this big jug with you, and then and you have to be fasting. They do a very big blood draw, 25 to 30 tubes of blood. And then you'll drop off the urine and then pee in another cup for urinalysis. And then after that, you'd head up to our clinic. There you meet the rest of the team. So at this point, you've talked to the advocate, social worker, and nurse. There in clinic, you'll meet with the surgeon, surgical physician assistant, the nephrologist or the kidney doctor, the dietitian, and you'll meet with the nurse again. And then if time permits, you'll meet with the donor advocate in person. Throughout the whole time that you're in clinic, the donor has to be fasting because you have to remain fasting until you do the CT scan. The CT scan is usually done around 12:30, 12 o'clock, but again, depends on scheduling. Sometimes they do get pushed out till 3 o'clock, so it's a long day of fasting. At radiology with the CT scan, once that's done, they'll do a chest x-ray, and then after that, the donor heads to cardiology. The cardiology testing depends on donor criteria, their family history, and their age. So it could be as minimal as just an EKG, where they put the electrodes on the chest and they look at the waveform. Or it could be where they do an EKG, they set up a 24-hour blood pressure monitor where you go home and then bring it back. And then an echocardiogram, which is an ultrasound of the heart, and then a stress test where you run on a treadmill and then they look at your heart. So that one varies quite a bit. And then as far as testing, it takes us about 3 to 4 weeks to get back to you as far as if you're approved or not, because then the next step would be to present to the selection committee. The length of the process really depends on the donor. Some donors get approved immediately after evaluation. Oftentimes it does get delayed. The most common thing to delay evaluation is the donor is otherwise healthy, but they have to lose some weight for us. And as we all know, that does take time and commitment and willpower. And then the other might be because the recipient is not ready. So sometimes we run into where the donor is approved quickly, but then we're waiting for the recipient to finish their testing, and they keep, finding things for them and they're just not ready. So it does depend. It does vary. Some donors will donate within 3 months of coming into our clinic. Some will within a year and a half. So it just really varies. As far as who pays for it, evaluation is covered for the donor. So the donor doesn't have any out-of-pocket expense for the testing. It is covered by the recipient's insurance and the surgery and the hospital stay. And then in the future, during recovery and the distant future, depending on the recipient's insurance, the donor will have benefits where any complication associated with the donation will be covered by the insurance of the recipient. So if they have Medicare, that's really the best for the donor. All right, next slide. So again, with living donation, it really addresses the limitations of a deceased donor kidney transplant, where we basically are only limited by the amount of time that it takes for the donor to do their evaluation, the recipient to do their evaluation, and then we can schedule the surgery. And so that prevents accumulation of damage over time while staying on dialysis. And then typically the kidney quality is much better with the living donor. So we can expect that kidney to last much longer for the person, reducing the possibility of needing another transplant in the future. And again, donor confidentiality is, I think it's been on a lot of slides here, super important to us. We don't want a donor to feel pressured when they're doing evaluation, especially by their friends and family. So we do not share any information to make sure that they feel safe. Yeah, and then donor evaluation and surgery are covered by the recipient's insurance. So we've already covered that. And as much as we want, because the recipient is our patient as well, but it's not our team's patient, our priority is always the donor. So whenever we evaluate donors, we're always looking at what is best for the donor first, and then we consider the recipient second. So donor safety is paramount. We do, and this is our transplant center information. So this is the phone number for the living donor team. And then this is the link for donors to sign up. So if you're a recipient or on the wait list and you have family or friends that want to sign up, they can go to this website and sign up to be a donor and see if they are a candidate. And this is the information for the recipient team for people on the wait list or an evaluation who have a living donor. So you can reach out to them. I know Fabiola is working on the Donor Champion program. So she has some resources with that. And I think this is
We're planning for future webinars
future.
throughout the year. The next one's going to be health and wellness tips, and how to improve your candidacy, different types of kidney donation. Mingus and Ernie, our transplant coordinators, are going to be presenting that, and then how to find a living donor. Fabiola will be presenting on that, and how to be a donor champion. Mental health support and financial resources for living donors will be another presentation. And then at the end of the year, we're planning a presentation with a living kidney donor that has donated in the past. So we're going to gather a few donors so that you can speak with them about their experience. Okay. And I'm going to stop share now, and then I will moderate the Q&A. Let's see if we have some questions.
I think there are some questions here we can start with, and while other people are forming their own questions. Maybe, Susan, can we put up the next step slide? It has the phone number and the website information so that people can see it. I think there were a few questions that we had answered during the talk. There was a question about kidney stones. And whether or not someone with kidney stones can donate. We would do a full workup. It really depends on the circumstances around the kidney stones, how big they were, whether it was just on one side, how, was there frequent occurrence? Dr. Ma, do you want to go into that a little bit?
Yeah, so I think the depend because after if you have a history of kidney stone and then after the donation you only have a one kidney. So if you have a recurrent stone, there's a risk of that kidney. So that's a acute kidney injury. You can have it when you have a stone obstruction. So your risk will be slightly will be higher. So that's a reason sometimes patients who have a bilateral kidney stone might be the one maybe not a good candidate for the donation. But it
Um,
depends, like Dr. Kim mentioned, it depends on why you have a stone. Some of them is can be modified. Sometimes some of them is people that have tendency to have a stone, then that is not a good option for the donation.
There was another question about the process taking a long time. And as we mentioned, donor priority or donor safety is a priority. And so sometimes the testing is extensive. Generally, if there's no repeat testing, if it's just the standard test
Yeah.
that we perform, there's nothing that we need to repeat or get any additional tests. The evaluation process can be fairly quick, and sometimes, especially with people who are traveling internationally to be a living donor for a loved one, we expedite those workups, and the evaluation can be completed within a month, and surgery can occur within I think the fastest we've done is within a couple months. Now, a lot of it also depends on the recipient side. So generally, recipients have more medical issues, more testing. Unfortunately, we can't share medical information, even if it's between family members. And so oftentimes, whatever is going on the recipient side, we may not necessarily be able to share with the donor. But those are the kinds of factors that play into the length of an evaluation. And then there was a question about becoming pregnant after
Yeah, so
donation.
that's I'm not sure
Dr.
it's a
Ma?
transplant or the pregnancy of the donor. So
Right.
usually
So
if it is a donor, then we suggest recommend to wait for at least a year to become a pregnant. It's safe to pregnant, but because of the donation, your kidney, one remaining kidney is still trying to recover. So we don't want to have another stress with the pregnancy. As you know, the pregnancy can have some complication so that's why we recommend to wait for at least a year after the donation.
Right, I think those were the questions that we had previously
And,
answered in the chat.
and
We
also
can
there
go
are
to the
two
live
questions.
questions.
So, the question for Carlos, I'm not sure is the recipient. It depends on your medical. Just a low blood pressure alone usually not rule out, but definitely we have to find out or evaluate why your blood pressure is low. So that is depending on we have to check your heart test, all those things. But depending on your other medical, not just a low blood pressure alone will be ruled out, but because of the low blood pressure might be a little bit higher risk during the surgery. So we need to find out or evaluate first the reason for low blood pressure. And then there's a question. I will be caring for the donor post surgery. Other dietary restriction. So for the donor, no. There's no dietary restriction for the donor.
There's a few questions about age. What's the youngest and the maximum age for donation?
So medical decision making obviously is at the age of 18. For anyone under the age of 21, we really take a very careful look at the donor family, the donor situation. We do also have a program, our sister programs that's at Children's Hospital. And we know that sometimes there are younger parents, family members that may want to donate. So the situation is different. So the absolute cutoff for age, absolute minimum is 18, but generally under the age of over the age of 21 is what is considered.
Can you talk about the pros and cons of non-directed donation?
So I can speak to that a little bit, and then maybe Mingus can jump in. So with non-direct donation, there are Advantages, the timing of the surgery can be one, just because the donor can dictate pretty much when they want to donate. They provide a window of time when they can donate. Oftentimes, people with certain jobs, or certain personal restrictions that only allow them a certain amount of time. That is an advantage. Some people who donate to a recipient or if they come in as a pair, oftentimes there's no other family members to care for them, and so being a non-directed donor can also the donor can donate, whereas the recipient can be their caregiver, and then after the donor recovers, then the recipient can get matched for a transplant, and the donor can actually become their caregiver. So those are just kind of timing advantages. But Mingus, do you want to speak to that a little bit?
Yeah. So I think the time compatibility is huge. Like we get a lot of couples where maybe the wife wants to donate to her husband, but they have kids and they're all grown up and out of state, so they need to take care of each other. So that allows them to switch off who's recovering from surgery. Another advantage is if somebody's being evaluated to be a donor, but then the recipient gets a kidney transplant. And let's say the recipient is fairly young, maybe in their 30s or 40s, the donor can donate as a family voucher. And because we expect the kidney will last, hopefully a very long time, but it's not as long as the person lives, and they typically need a second transplant. So they can donate as a voucher, and then when that recipient needs a second kidney, they can cash it in a sense, and be able to get their living donor kidney then. Another consideration is if the donor is a parent and maybe they're in their 60s and they're still in great shape, but their recipient is their child in their 30s. It's not ideal to give such an old kidney to a young recipient. So the exchange that we use, the National Kidney Registry, allows us to get a more age appropriate recipient or I'm sorry, age appropriate donor for the recipient. And then also, National Kidney Registry does offer additional donor protections for the donors. So for all donors in the US, when they donate, they get registered with the United Network of Organ Sharing, where they get priority on the deceased donor wait list, which is the equivalent of like 4 years of wait time, 4 points. But with the Donor Shield program, the registry promises them a living donor kidney with essentially no wait time, or just however quickly they can get evaluated. And then there's also financial assistance attached with that. So kind of a nice peace of mind for that with the non-directed donation option. For some people, the financial assistance makes donation possible, because some people, if they can't take time off from work and they don't have the PTO or money saved up, Donor Shield can really help with that. I think that's yeah. Oh, and then incompatible donors, those cases, um, we can have uh, we can still have the donor donate even though they're incompatible with their intended recipient.
And also, if there is no intended recipient, we do have people who want to donate, and so that also is a non-directed donor. I don't know that was if that was included in that question, but for people who don't have an intended recipient, we will do a full evaluation, and the same process, and then we'll talk to you about the different options going forward.
There's another question about weight loss and evaluation. If I have to lose 15 to 20 pounds, do I have to do a full workup again once the weight is lost after the first full day of evaluation?
Usually, no. It depends on the how quickly you lose the weight, right? If it is more than a year, then we will do the blood test. But the CT scan, we don't need to repeat it. So basically, for the blood test, we want to have with at least make sure that your kidney function is the same. So it depends on how what was the time frame you lost weight. So within 6 months to a year, then we don't need to do all the workup. But definitely you will need to be seen again by the dietitian, go over. So yes, the CT scan now, because they don't change, but the blood test, kidney function test, the cholesterol, whatever we recommend, we will have to repeat the lab test.
I have a question about financial assistance. For jobs that may not accommodate time off or not enough time off, is there any help that is provided for someone donating in terms of like financial assistance or resources?
Yeah, I could answer this one. So we do have there is NALDAC, which is the National Living Donor Assistance Center. It's a federal grant that will cover some lost wages. I think they only cover for 3 weeks after donation, and they require you to apply through California State Disability, and then they will cover up to $1,200 a week for anything that isn't covered by California EDD. So it's not super great. Um, if that is a huge barrier, we would recommend to look into possibly donating through the exchange to get Donor Shield. They are much more generous, where it covers up to $2,000 a week. So whatever you make, if you make $1,700 a week, you'll get 17, but it's up to 2,000 a week, and then that will go up to 12 weeks. Typically, most people take 6 weeks to recover, because for the longer, then we have to justify it with a complication. But I hope that answers the question.
There's another question about age. Is there a maximum age limit for donating?
So I think that it depends on your health. Definitely because of the older that you are, the medically your kidney function also decline by age. So after 40 year, your kidney function because of the aging, the kidney starting to kind of every year little by little. So by the time when you get to 70 or 80, your kidney function will be, even though you have no kidney disease, your kidney function will be lower. So usually there's no maximum age, but we do have a donor with a 67, 70, but totally depending on the function of the kidney, the donor health is most important because, like I mentioned before, the safety of the donor. So the older that you are, your surgical risk will be higher. So these are the one we need to look at it. So it's a difficult to answer the maximum age, but definitely over 70 has to be very rigorously. We have to go through, we have to counsel, looking at it. What are your own risk of the donation?
And then how will donation affect future health or life insurance?
It should not affect, no, it should not affect the life insurance. They should not be. The life insurance should not be declined because of the kidney donation or some, yes.
And if the living donor is out of state, how soon does the kidney need to be transported? I think they have like a logistical question about how that works.
Yeah, maybe I can explain that one. So it depends, like if the donor, if we're doing like a remote direct where the donor is at another transplant center and they're donating, the logistics would be arranged so that the kidney basically goes the same day. Typically, when we have a kidney coming from another transplant center from a living donor, the kidney will be on ice for anywhere from 10 to 14 hours. And kidney can tolerate a much longer time on ice and still be viable. So, but yeah, it would be same day. Like if the donor has surgery at a different transplant center out of state, um, the recipient would have the same day.
Generally, all of these cases are coordinated. So
Hmm.
if the donor is donating from out of state, or if the donation surgery happens at Keck and the recipient is at a different center, all these cases are coordinated. So there are couriers on standby, flights, and all the travel transport logistics are worked out way before the actual day of surgery. So, and there's contingency plans that are also in place. There's never been a kidney, knock on wood, that's been lost through this process. in I guess the almost over 10 years that this has been occurring. And so yeah, there's a lot of logistics that go into it, a lot of planning. But we always do the transportation, all of that, well within the time limit to be able to do the transplant.
What about a patient that's been on dialysis for 9 years? What are the chances of getting a kidney transplant versus a living donor? I think they want to know like the pros and the cons if you've been on the dialysis for 9 years.
So living donation is still the best kidney that they can receive, that the recipient can receive, no matter what, no matter how long they've been on dialysis, no matter how long their waiting time is. Living donors are always going to be better than deceased donors. So the time on the waiting list, that's going to really dictate whether or not they receive a deceased donor. Unfortunately, in this area, in Southern California, the wait times are among the longest in the country, if not the longest. And so people do wait sometimes more than 10 years for a deceased donor kidney. For someone who's been on dialysis for 9 years, really depends on some of the factors related to their other medical diseases and the cause of their kidney failure, how well they're doing on dialysis. There's a lot of different things that go into it. But overall, living donor kidneys are always going to last the longest amount of time. And that's what we encourage. If there are questions on, if the recipient has been on dialysis for many years, we can talk specifically about that with the recipient, and then any donors that are interested in doing that can still go through the process. And as Mingus mentioned, with the exchange, with the kidney pair donation process, you can also donate on behalf of a recipient who may already receives a transplant, and there is a voucher that can be that's reserved in the future if that person would need a kidney transplant, if the recipient would need another kidney transplant.
I think we have time for one last question. What's the process for international donors? Do they have to be related?
Yeah, I can answer that. They don't have to be related. However, they have to be able to get here on their own. We can provide a letter saying that they're going to come to the US to be evaluated for a kidney donation, but that's kind of it. Unfortunately, there's not much more we can do. Um,
We do have a international liaison
yeah.
office that will help facilitate some of those things. So you can call our office or connect with the international liaison office at Keck Medicine.